I'm Jane DeFranza. I live in Washington, and I have 4 boys, mostly older. My youngest is 16. 3.5 years ago, I was diagnosed with anal cancer, and it took me 2 years to be able to even say that. It was, it's an embarrassing kind of cancer, and the treatment for it is grueling. I had chemo and radiation at the same time. So, and the radiation that I had was exceptionally rough. I had full radiation around my whole pelvis. So unfortunately, I had a lot of damage with it. Unfortunately, it damaged my bowels, it damaged my bladder, it damaged basically everything that you can think of that's in the pelvis. And for a good year after, I was in a lot of pain. I can't stand up, sit down without pain. The joints, my hip joints are really bad. And I continued and thought that, well, this is what's going to happen. And, the cancer was gone, which was wonderful. And I kept hoping that someone would say, okay, this is going to be how your life is, or where it's going to get better. And all I really wanted was somebody to tell me, this is your life. Because then I could get on with my life at that point. Up until I came here, I basically was couch-ridden, as you could say. I would sit with a heating pad basically all day. The pain was terrible. They had me on, the painkillers, but I wasn't really getting any better. So after 2.5 years of dealing with pain, my general practitioner recommended going to palliative care. And I had no clue what palliative care was. No clue at all. And my good friend up the street, unfortunately, he had colon cancer, and he was going through a lot also. And I did get some literature from him on palliative care, so I read up on it. And I said, this looks like it might be the thing for me to go. Met with Dr. Bauman, who I loved immediately, and her first words were, we'll make you feel better. We'll treat that. And it was the first time that somebody looked at me for me and not the pain or not the disease. She was treating me as Jane DeFranza, not the cancer. And she put me on different medications, and I'm still in pain, but it's a different kind of pain. I can deal. I am up every day. I play with preschoolers. Unfortunately, I can't work full time because of the residual effects of the cancer. Luckily, I was able to, I'm not working at the school, I'm volunteering at the school. Some people call it work, I guess. But you know what? I go every day if I can. There are many days that I wake up and I say I can't, and that's okay. I'm so fortunate that I'm able to do that. But my biggest medicine was, having those little 4-year-olds running up to you and giving you hugs. And I really think it's been because of the palliative care. And then after I did the palliative care, I think I had gone maybe 2-3 times, and Eleanor kind of reeled me in, and she said, I do Reiki, and she said, would you be interested? And I said, well, explain it. And she explained it, and I tried it, and it's wonderful because this is my time when I do it. It's, this is specifically for me and my mind, and it's just, I get to relax. And it's funny because I hadn't gone for 2-3 weeks at one point, and the difference in my personality, because it just puts you in a different realm. It just, you relax. And like she says, you may still have pain, but you're able to deal with the pain differently. Mentally you can deal with it. And it's amazing how I speak to people that I haven't seen in a year, and they look at me and they say, wow, because I'm getting back to somewhat a normal life, which is wonderful. This is what I need. And like Dr. Bauman said, I spoke to her and I said, is this what I'm going to have to deal with? And she said, probably. And I said, that's all I needed to know. That's all I wanted to know. For somebody to just tell me, this is what you're going to have to deal with, and it's okay. Because the cancer's gone, I'll deal with the pain, and she's helping me deal with it.
I'm Eleanor Schreiber, coordinator of the Palliative Care program at Hunterdon Medical Center and a certified Reiki master. Reiki is a universal energy relaxation technique. It is Japanese in origin, and basically what it is I gently lay my hands on people and they get universal energy to balance. If you think of your body as water, you want that water to be balanced, and if we're balanced, we can deal with everyday stresses as well as anxiety, any kind of pain better. It works in conjunction with mainstream medical treatments, and patients report that if they do Reiki in conjunction with regular medical therapy, their outcome is much better. People have Reiki done for a variety of reasons. My most common one is the cancer patients. They like Reiki because it does help with side effects from chemo. It helps less nausea and vomiting. Why exactly, I can't answer, but it does work. It helps them feel relaxed. Many patients, when they're coming into the hospital for all the treatments they receive, have anxiety. Reiki helps with anxiety. It helps people to sleep better. It helps just with an overall sense of being well and loved and taken care of. And they leave here almost feeling euphoric and cared for. And I think that's so important. When they come to see us, we're seeing them for a variety of reasons. But one of the reasons that I want them to walk away from this experience is that we care about them as a whole person.
I'm Dr. Susan Bauman, Director of Palliative Care Services at Hunterdon Medical Center. Palliative care is a relatively recent medical service that's provided to anyone who's struggling with a serious illness. Palliative care seeks to relieve the symptoms a person may be suffering from their illness, and also to improve their quality of life by discussing what's important to the person, what their goals are, and sometimes helping them make certain decisions about their disease. Because it's so multifaceted, palliative care is provided by a team that includes a physician, a nurse, a social worker, a chaplain, sometimes other members providing complementary or alternative treatments such as Reiki. And what we do is we find out what sources of discomfort or suffering might be for that patient and their family members. For some people, it's primarily pain or other physical symptoms such as nausea, vomiting, trouble breathing. For other patients, it might be emotional distress or depression and anxiety, and sometimes even spiritual distress for people facing a serious illness. So we come together as a team. We try to address symptoms and help support patients and families while they're fighting their illness. We also help them decide what their goals of care are and help them with decisions that need to be made. palliative care can really be provided at any time in the course of a serious illness. And that is one of the things that makes it quite different from hospice. Although hospice workers are also a team and they provide comfort and relief of symptoms, they are limited to people who are near the end of life, whereas the palliative care team can work even from the time of diagnosis to help support the patient while they're fighting their illness. In fact, studies recently have shown that people who receive palliative care services early in their disease live longer and do better, as well as being more comfortable. Jane is a very good example of the advantages and success of palliative care and the team approach. And it's very interesting that I did not meet Jane until she was actually cured of her serious illness. So she no longer had a cancer diagnosis, but she had multiple symptoms such as pain, which had not been controlled. And she was also suffering because she was not able to function in a way that she had been in the past, was not able to do the work that she loved, and was distraught because of that. And so with the team working together, we were able to get her symptoms under control and also get her to a higher level of functioning so that she could do the things that she wanted to do. And in fact, many patients that we see in palliative care are cancer patients who have been cured of their cancer but still have uncomfortable symptoms or are just not able to function as well as they would like. The general public has a lot of misconceptions about palliative care, and some members of the medical profession have misconceptions about palliative care also, and feel that it should not be introduced until later in a disease when a person is really not doing well. But I hope that I'm able to convince people that there's no reason to wait for palliative care. If you have uncomfortable symptoms or you or your family members feel like you need extra support to get through this challenge, it's never too soon to call palliative care.